All right, guys, Dr. Ray back here with you, and it's still October, and we're still trying to save the tatas, right? So we talked about prevention a little bit earlier, and in the event that you can't prevent breast cancer from happening, early detection is the next best thing. So right now, mammography is a tool that's commonly used. However, mammography contains compressive forces that may not be good for the breast tissue, and it also has some radiation to it. So as you know, we want to decrease radiation as much as we can. And a great way to do that, and an adjunct or sometimes an alternative, could potentially be breast thermography. So thermography is no radiation. It's literally just creating thermographic pictures of the breast and creating a timeline of those. So you start with a baseline, 3 months later you take another one, and if there's no difference between those two, then now you've established a baseline. When you do that on a yearly basis, you can look for changes in vascularity or in the temperature, and this can clue us into when there might be changes in the tissues in the breast. Thermography has actually been shown to detect changes 18 months before a mammogram would. So not only do you not get radiation, but it will detect changes faster. So in addition to thermography, one of the things that I do in my practice is hormone testing for those women who seem to be at risk for breast cancer, whether it's through personal history of fibrous breasts, or irregular menstrual cycles, or very symptom-laden menstrual cycles, or that they have breast cancer within the family. So what we do is look at hormones, and not just estrogen and estradiol and estriol, which are the three forms of estrogen, but also the metabolites of these estrogens, because there's a certain type of estrogen that has actually been shown to cause changes in your body's DNA. And this type of estrogen happens when there's a lack of vitamins, when there's a lack of B vitamins specifically, and sometimes this can change by the immune system. We always address the immune system. We always look at these hormones for these higher risk women, and this is how we can really make a big difference in preventing what's going on. There's a lot of natural things that can be done in order to change the way that the body is detoxifying and metabolizing these estrogens, and by doing so, we can hopefully prevent and never have to even take a mammogram. So if you guys have questions about what you can do to prevent and early detect breast cancer, if you're at risk, or if it's something that you've been scared about, go ahead and let us know. Post a question in the comments, and we'll be more than happy to take care of it for you.